If you or somebody you love has been recently diagnosed with cancer and you're looking for all the different options that you could possibly find, you may have come across the idea that hyperbaric oxygen therapy is being used for patients diagnosed with cancer as part of a multidimensional, multi-therapeutic approach to helping these patients heal. Using hyperbaric oxygen therapy for patients with cancer is absolutely a very controversial conversation at this point. And so I'm going to be as clear as I can be in understanding the potential benefits and, of course, also the potential consequences of using this type of therapy for this condition. Let me first say crystal clear that hyperbaric oxygen is not the cure or a direct treatment for cancer. That being said, there are multiple spheres within the world of oncology that are looking at the role that hyperbaric oxygen could play with these patients. Traditionally, with cancer therapies, hyperbaric is now being looked at as a way to reduce the consequences of chemotherapy and reduce the consequences of radiation. And so might this help play a role for patients to reduce their toxic load and or reduce some of the symptoms that they're getting from their traditional chemotherapy and radiation treatments? A slightly more controversial conversation is there is synergy between chemotherapy and hyperbaric oxygen. And as a result, with certain chemotherapies, hyperbaric oxygen may make chemotherapy more toxic. What does that mean? It means that it's actually increasing the effectiveness of that chemotherapy in some cases. So two questions come from that. Number one, is it safe to use hyperbaric if that's the case? And or is there a way to make sure that the amount of hyperbaric and the amount of chemotherapy are keeping our patients safe? And then there's a secondary conversation from that, which is to say, maybe if hyperbaric makes chemotherapy more toxic, if we were using hyperbaric therapy as part of the treatment, could we reduce the amount of chemotherapy that patient needs and still make all the benefits we're looking for from chemotherapy to be present while reducing the consequences and side effects of the chemotherapy itself? And the third, even slightly more controversial conversation is, can hyperbaric be used as an active part of the treatment for the cancer patient? There's a movement in the world of oncology to talk about the metabolic portion of this disease, not just the genetic portion and the immune system portion, but the cellular metabolism. And if hyperbaric oxygen can actually play a role in shifting that cellular metabolism to do two things. Number one, actually help to kill cancer cells. And number two, help to keep the rest of the body, the rest of the cells, as healthy as possible during that process. We're going to cover all three areas right now. We're going to first just start talking about the approach to using hyperbaric oxygen in a more traditional oncology type program. And here we can go to the research and just say that hyperbaric has been used for decades for post-radiation necrosis. In other words, we know that there's this delayed consequence of high levels of radiation in traditional oncology, and that hyperbaric oxygen actually helps to promote and regenerate the tissues that are now chronically damaged from the radiation. That's not controversial. There's a lot of research on that. Now, if that's the case, could we also use that same thought process instead of waiting until we have these post-radiation consequences or these post-chemotherapy consequences like the post-chemotherapy neuropathies? Could we be using hyperbaric oxygen throughout the treatment process to, number one, reduce the negative effects of chemo and radiation, and number two, to try to keep the rest of the tissues, all of the surrounding cells and tissues of that person, as healthy as possible during the duration of those traditional treatments? So there is quite a bit of research now developing in both of those fields. And what it looks like so far is that yes, hyperbaric oxygen will reduce some of the consequences of chemo and radiation. And at the same time, it will help save or salvage the healthy cells and the healthy tissues and help make sure that the surrounding cells and tissues aren't compromised by the traditional treatments. So there's a lot of favorable research that's coming out of looking at hyperbaric oxygen in combination with traditional therapies. The next layer was using hyperbaric purposefully due to its synergistic effect with chemotherapy. Certain chemotherapies have a synergistic effect with oxygen, the oxygen making the chemo more toxic, which begs the question, could we get all of the effects that we're trying to get from the chemotherapy and reduce the chemotherapy load, helping to reduce the need for how much chemo that patient requires to get the benefits of the chemo without the consequences of that treatment? Now, there is research in this field as well. I don't know that any of this research has been done in the United States yet. However, in other countries, they are looking at ways of reducing the total amount of chemo necessary by adding hyperbaric oxygen, thereby keeping the chemo effect, but reducing the symptoms and consequences of the treatment. And it does seem to have some promising future in the world of oncology. We do, however, have years ahead of us in more research to really understand the synergy between those two and making sure that we're doing that in a way that's keeping patients safe long-term. This third conversation, which is certainly the most controversial version, but it's also the most exciting for me and probably many of you, is can we use hyperbaric oxygen as part of a very different type of approach to oncology overall? There was a book written by Dr. Thomas Seyfried, Cancer as a Metabolic Disease. In this book, and in the research that was used to write this book, and in the research that's come since that book was written years ago, there's been an entire movement in looking at the metabolism of cancer cells, how cells use the energy that we eat to create cellular energy for function. And in this model, what we're talking about is a dysfunctional metabolism leading to the opportunity for cancer growth. If cancer is a metabolic disease, that begs the question, can we shift cellular metabolism and use that as a treatment for this disease? And then if we can do that, is hyperbaric an appropriate tool to be used in that conversation? There's a tremendous amount of detail in the book, Cancer as a Metabolic Disease by Thomas Seyfried. It is a terrific textbook. There's also a layperson's book written by Travis Christofferson called Tripping Over the Truth. And he goes over many of these concepts, but in a much lighter, more easily digestible way. But these could be great resources if you're trying to learn more about the conversation of cancer as a metabolic disease. And what we'll do is we'll link to both of those books in the description below. So if you're interested in either one of those, you'll be able to click there and gain access to those. The very brief summary of this process would be not all tumors, but most tumors, especially solid tumors, seem to have two characteristics. Number one, they don't metabolize fat very well. In fact, they're almost exclusively burning sugar and glucose as their energy source. And number two, they're not using their mitochondria. And what they're doing is instead of putting those nutrients into the mitochondria for further breakdown and further energy production, those glucose molecules are being fermented in the cytosol inside the cell, and through a process of lactate fermentation, continuing to make energy, but very inefficiently. That process of energy production is done without oxygen being present. In order to create energy in a healthy cell, we typically have oxygen present, and when the breakdown of our food is mixed with oxygen, that's driven into our mitochondria, and that's where the most amount of energy will be produced for cellular function. So if cancer cells don't have that ability, in other words, there's mitochondrial dysfunction, there's glucose fermentation without the presence of oxygen, it's an inefficient way for that cell to make energy. Can we shift that cell into a fat metabolism, even more so into a ketone metabolism, in the face of oxygen, and either repair that cell so that that cell is working normally again, or help to kill that cell because that's a cancer cell that's metabolism is completely dysfunctional. And ultimately, the mitochondria is one of the most important organelles to determine apoptosis or cellular death. And so what we believe that one of the mechanisms to help kill cancer cells in this pathway is as we load those cells with increased levels of oxygen, if that mitochondria is unable to utilize that oxygen and drive those nutrients with oxygen into the mitochondria for energy production for that cell, then that helps the mitochondria to signal cell death or apoptosis to get rid of that cell so that it can stimulate new stem cells to come into that area, new healthy stem cells to come into that area and actually fill in those gaps and have normal cell and tissue function at that point. So again, similar to that second conversation of combining chemo and hyperbaric and potentially needing less chemotherapy to have the same effect while also salvaging the rest of the healthy cells and tissues, this conversation of cancer as a metabolic disease is also something that's relatively new and we still need a tremendous amount more research, which is currently being done. That being said, any research that I've seen so far on this topic, especially with very aggressive cancers like GBM, glioblastoma, brain cancers, very aggressive brain cancers that have a very short life expectancy while also having a very high metastatic rate, it shows great promise using metabolic techniques like nutritional ketosis, like helping those patients fast, using certain medications and certain supplements that help reduce glucose metabolism, and then using high-dose hyperbaric oxygen, all driving cellular metabolism toward fat-burning metabolism, away from glucose-burning metabolism, to help shift those cells. Now, healthy cells love that type of challenge. Healthy cells love the idea of strategic adversity and hormesis, challenging the system and helping the body to adapt in order to become healthier over time. Cancer cells are typically very inflexible and very non-adaptable. And so when you push a really strong metabolism in a certain direction, if those cancer cells can't adapt and change, and in many cases they cannot, that helps to promote the cellular apoptosis of those cancer cells. So while 20 years ago, hyperbaric was actually a contraindication with cancer therapy, in the last 3 to 5 years, it's gone from a contraindication to actually indicated. And I could see in the near future actually being recommended as part of a frontline therapy for those patients diagnosed with cancer. And I'm excited about that because we desperately need new and different approaches to this disease because so many people are suffering. So the ultimate answer to the question is hyperbaric oxygen appropriate in cancer treatment? The answer to that for me is yes. The real answer for that is it will depend. Is this somebody who's still actively going through chemo and radiation? Is this somebody who's done chemo and radiation and ultimately their cancer is resistant to traditional therapies? Is this somebody who's trying to avoid traditional therapies like chemotherapy and radiation, and they're looking for different types of answers? Ultimately, the way hyperbaric would be applied in all three of those cases would be dramatically different. So what's really critical in this conversation is to say, if you're interested in applying hyperbaric therapy for yourself or for a loved one diagnosed with cancer, you need to understand the complexities here. It should be a joint decision between practitioners of hyperbaric oxygen, along with maybe your traditional oncologist, or perhaps you've already been looking for, or you're already working with what's called a metabolic oncologist, an oncologist that understands the metabolism of cancer and is already providing different approaches to helping offset the consequences of either traditional chemo and radiation or the consequences of cancer on its own. And now you're just looking to add hyperbaric into the mix. In any case, please don't make these decisions lightly and don't make these decisions alone. Make sure you have a team of people that understand the complexity of this conversation and can apply all these different therapies in the exact way that you need them to. I hope this helps answer that question of is hyperbaric oxygen appropriate for somebody diagnosed with cancer? And I hope I've done my job to really help you understand how important it is to have professionals work as a team on either your behalf or a loved one's behalf, and that you can put together a full spectrum of this multi-therapeutic approach for cancer. Thanks again for your time and attention, and we'll see you on the next video. So whether you're a chiropractor or a naturopath or an acupuncturist or a DO or even an MD, but you're looking at hyperbarics through this lens, the lens that I'm describing, which is applying hyperbarics for all these off-label conditions, this is the class that teaches that. And right now it's the only class that teaches this type of hyperbarics in this way, and that's an actual certification course. Check out hbotusa.com, and right across the top you'll see upcoming events. You can click on that and it'll show you when our next courses are going to be.